Dr. Kyle with Project Wellness Company. One thing we want to talk about today is ankles and ankle issues and pains that we're going to get. And so throughout our lives, sometimes what we'll do is we'll rotate an ankle or we'll sprain one where that ankle comes inside or it can go outside. And when that happens, what we're actually doing is we're stretching those ligaments out, which is going to cause some laxity in those ligaments in through there. And while that's happening, sometimes what can happen is we can actually subluxate some of these bones within our feet. All too often we have one that sits right up here at the top that will subluxate. And so that's going to allow us to have issues with that flexion, bringing that back up, or we'll even get some pain point tenderness right here. And then as well, some of the other ones that tend to have issues when we roll that, because of where these ligaments are attaching, there could be some tenderness down in through here upon our cuneiforms, which ultimately these bones come down in a touch. And so what we want to do is we want to evaluate those as well to look to see if there's any issues. And then as well, another common issue that's going to be dealt with within our office is what's called plantar fasciitis. And what happens there is the ligaments on the underside of the foot are going to get really tight. And so a lot of times we'll get pinpoint pain right at the base of the heel here, and even sometimes running up through the different arches depending on how tight those ligaments are at. Now, if it's a plantar fasciitis issue, we want to break up the adhesions in through there, and so we're going to use certain techniques such as like Graston, where it's a soft tissue thing where we're working to break up adhesions in the foot specifically. But all the while we want to make sure that we're adjusting the foot to make sure those bones are all sitting where they're supposed to be. A lot of times we don't even realize, but there's just as many bones in our feet as there are our hands. And so we want to make sure that those are all sitting in the positions that they're supposed to be. So a way to check that is, once again, we're going to come in here and we're going to motion that out. So I want to look to see, is there movement in that joint? And if there's not movement in the joint, what we're going to notice is that restriction. And so if there's restriction in our bone right up at the top here, we just want to contact that, give it a little bit of a pull, and you can hear that actually move and set right back into place where it's supposed to be. And then the other one as well is our calcaneus, which is our heel here. We're going to wiggle that from left to right just to make sure that's sitting where it's supposed to be. And so for her, you know, that one's where it needed to be, but we did have an issue here. And so then what I want to do is I want to check these cuneiforms on the outside. So I'm going to come in here and just kind of apply some pressure. I'm going to move them, just making sure that they're where they need to be. One thing that she would let me know if we were having issues is it'd be pretty tender or painful right on those spots where those cuneiforms are lying, which for her, they're all sitting pretty good, I would imagine, because they don't hurt. And so that's a way to adjust the bones in the feet to make sure that they're moving correctly. That ankle mobility, if we have restriction, you know, pulling that ankle up, pushing that ankle down, that's going to allow us to know specifically where those issues are lying. And like I said, if we had some plantar fasciitis, I'm going to have you go ahead and bend this just so we can see. Okay. Essentially what we're going to be doing is we're going to be working, you know, from here all the way up to where these are attaching, and making sure that all those ligaments are nice and loose. So we'll clear the joints out, making sure that they're adjusted. And then what we want to do is we want to work to loosen those specific ligaments down in through there to work to get rid of those adhesions, so that way that first step in the morning isn't painful, or getting up out of a chair isn't painful in those first couple steps, because those would be typical plantar fasciitis issues that we would have with somebody presenting with that within the office.